When you hear the words hip surgery or hip replacement, you most likely think of an elderly person that would usually have health issues anyway. Would it shock you to think that a child ages 10 to 16 can also have a serious hip problem? There is a hip condition that is called slipped capital femoral epiphysis, also referred to as SCFE, that only occurs in children. A basic description of SCFE is that the ball and socket joint, the femur and the hip socket, are uncomfortably pressed against each other, which can cause wear and tear on the bone, except for that the femur slips past the socket and pushes out of the hip bone slightly. This syndrome occurs in preteens that are still growing, and the origin behind the condition is still unknown. I have become interested in this disease because of my 12-year-old sister. She was misdiagnosed with this condition a few weeks prior, and I researched it frequently when I thought this was the condition she had. Today, I would like to go more in depth about this condition and share facts about the symptoms and potential treatments for slipped capital femoral epiphysis, or SCFE. For you to further understand what the disease is, I will show you an X-ray image of a male child with SCFE from the Pediatric X-ray Scans section of Pediatric Radiology from 2013. Okay, here is a scan of slipped capital femoral epiphysis. This is a slight slip, and this is a larger slip. You can see how the hip socket is supposed to be turned up this way, and it's turned sideways. The anatomy of the hip consists of the ball and socket joint shown here on this screen. The ball is the tip of the femur/thigh bone, and the socket is a large pelvis bone. The epiphysis plate moves to eventually become the femoral head. According to an article from Kids Health written in 2019, SCFE is more prominent in children that are obese or extremely active because when immense pressure is applied to the ball and socket complex, the femur essentially slips past the growth plate. When the femur moves behind the plate, it can cause discomfort or in some cases extreme pain to the point of not being able to walk. This condition only occurs in adolescents and usually in children between the ages 10 to 16 that are going through a growth spurt. The symptoms of slipped capital femoral epiphysis can be confusing or easily misinterpreted by the child or the parents of the affected child. Parents may often think that it is just normal growing pains or that the child may have pulled a muscle. The main symptoms include pain and tension in the hip/groin area. There are two types of SCFE that are often identified by the extremity of the symptoms paired with an X-ray. There is stable SCFE, which includes slight pain, a limp, and crutches may be required to release some of the pressure. Then there's unstable SCFE, which makes it to where the child is unable to put any weight on the hip, and it can restrict blood flow to the hip, resulting in potential tissue death in the femoral head. I want to show you some images of the stable versus unstable slip. Okay, this is a stable version, which is really kind of hard to see. I want to come a little bit closer. I guess it's just a slighter slip than in this case, where you can see the femur is literally, it's worn down and it's turned up. And this is also an image of how you fix it, which I'll talk about in a minute. Okay. This is unstable, once again, SCFE. I obtained these x-rays from an article about the condition posted on the American Academy of Orthopedic Surgeons that was last updated in 2019. After the x-ray image indication of SCFE, and in some cases MRI scans, along with involuntary muscle spasms and a limited range of motion, the diagnosis of the disease can be confirmed. And there really is only one potential treatment for this disorder: surgery. According to Kevin Walker from Medscape, the only real solution is internal fixation, and it must be fixed as fast as possible to prevent further damage. Ultimately, screws are put through the femur and into the hip to hold the socket in place and prevent any further slippage. Here are some x-ray images to show the screws. This is one. That was the unstable version. And this is another. And on the right here, this is them trying to prevent this hip from slipping because this one was unstable, and they put 2 screws in, and the surgery is called in situ fixation, and it just holds the femur into the hip socket to prevent it from moving. And then this one was to make sure that one didn't move at all in the future. In conclusion, slipped capital femoral epiphysis is a hip condition occurring in young adults that causes pain and potential deformities. It is best treated by surgically implanting a metal screw into the ball and socket to prevent further movement of the epiphyseal plate. The specific cause of the SCFE hip condition has yet to be discovered. After the surgical treatment, there are many methods of recovery, such as wearing crutches for weeks, physical therapy, and activities to help increase mobility. And I just want to real quick show you pictures of a boy with this SCFE. His leg appears longer than the other. That's another long-term effect. Okay, and that is the end.